The AIDS conference returns to the Bay Area for the first time in years, going virtual for the first time, and we're learning how the coronavirus pandemic is having a major impact on treatment and prevention of HIV.
And we are learning how the coronavirus is having that impact on the treatment and prevention. Let's get to Liz Cook with the very latest on that for us. Liz?
Alan and Veronica, the 23rd International AIDS Conference opened today. It's hosted by San Francisco and Oakland, but thanks to COVID-19, the impact has been monumental. 30 years ago, the last time the AIDS conference was in the Bay Area.
I was the co-chair of the meeting in 1990, so I know better than anyone what was happening. It was a mess.
AIDS activists virtually shut down all of San Francisco. The conference has not been back to the Bay Area, that is, until now. And now it's all online.
We get the conference 30 years later, and then the pandemic hits, and we had to make it virtual.
Dr. Monica Gandhi of UCSF is co-chair of the 5-day conference. She says, make no mistake about it, this new pandemic is overlapping with the older one.
COVID is impacting HIV so massively in terms of treatment, in terms of prevention, in terms of susceptibility, in terms of testing, that we have to talk about the intersection.
COVID has set back HIV progress in several major ways. One is access to treatment.
Antiretrovirals are more expensive, and we're not getting into areas of sub-Saharan Africa.
Patients are foregoing important medicines used to prevent HIV because they won't go to the clinic. Thanks to the economic turndown, risky sex work is now on the rise. And as for testing,
coming in, you're testing for COVID.
4 days of the conference will be dedicated to the latest scientific advances when it comes to HIV. 30 years ago, there were no effective treatments. The virus was a death sentence.
Everyone died. Everyone that got any kind of symptoms from HIV infection in 1990 died.
Dr. Paul Volberding is known for pioneering work in treating patients with HIV. He says in the fight against COVID, there's a lot to learn from how public health responded in the early days of the AIDS epidemic.
Always tell the truth as best you understand it, with the understanding that it might change tomorrow.
One major advance Dr. Gandhi told us about were the results of a study that will be presented this week. An injectable medicine to help prevent HIV. Instead of taking a pill every day, people would get a shot every 2 months. Veronica?